All right, let's talk about a drug you've almost definitely heard of, furosemide. You might know it by its brand name, Lasix. It's everywhere, famous for being a powerful water pill. But what's so fascinating is that it's hiding a secret that makes all the difference in the most critical moments in medicine.
So here it is, the central puzzle we're going to solve today. You've got a drug that's supposed to make you pee to get rid of fluid. But in a life-or-death emergency, like acute heart failure, it starts working in just a few minutes, way before it's actually had a chance to do its main job. How on earth does that work?
Let me paint you a picture. Imagine the emergency room. A patient is rushed in, they're in acute heart failure. Their lungs are literally filling up with fluid, and they can barely breathe. The medical team immediately pushes an IV dose of furosemide.
And it feels like a miracle. Within just a couple of minutes, you can see the patient's breathing get a little easier. That desperate struggle for air starts to calm down. But here's the kicker. They haven't started peeing yet. Not at all. So if the relief isn't coming from getting rid of fluid, what in the world is going on?
Okay, to crack this case, we have to start with the official story, the one we all learn about how this so-called water pill is supposed to do its thing.
So yeah, furosemide is what's called a loop diuretic. Its main claim to fame, its whole purpose, is to tell your kidneys to go into overdrive and start dumping excess salt and water out of your body.
And it gets really specific. This all happens in a part of the kidney called the loop of Henle. You can think of this spot as having a revolving door that usually lets salt back into the body. Well, furosemide comes along and just jams that door shut. So now the salt can't get back in, and wherever salt goes, water follows. So all that extra salt and water gets flushed right out as urine. Seems simple, right?
But here is the critical clue in our mystery. When you give it through an IV, that whole diuretic effect, the actual increase in urine, it doesn't really get going for about 30 minutes. And that brings us right back to square one. If the main event takes half an hour to start, what is performing that life-saving magic in the first 5 minutes? Clearly, the water pill story isn't the whole story. Not even close.
And that's because there's a whole other story happening under the surface, a hidden mechanism that kicks in almost instantly. This is where we find the real secret of furosemide.
The immediate relief is on a totally different clock. We're talking about 5 minutes. So for a moment, I want you to forget about the kidneys. Furosemide is playing a completely different game here, and it is spectacular.
The first secret mechanism is a process called venodilation. Now that's a fancy word, but all it means is that the drug makes your veins relax and get wider. Think of it like a backed-up highway suddenly getting 3 new lanes. All at once, the veins can hold more blood, which instantly takes a massive load of pressure off the overwhelmed heart and lungs.
So how does it pull this off so fast? Well, it acts directly on your blood vessels. It triggers the release of things like prostaglandins and nitric oxide, which are both super powerful chemicals that tell blood vessels to chill out and expand. And get this, it doesn't just work on veins, it also helps relax the airways in your lungs. That's called bronchodilation. That's why the patient can breathe easier, almost right away. Furosemide is a vascular drug first.
And hey, this isn't some brand new theory. Researchers have known about this for decades. A landmark study all the way back in 1974 pointed this out. They found the very first measurable thing that happened after giving furosemide was this huge increase in how much blood the veins could hold. And it happened, within about 5 minutes.
So when you put it all together, what we really have is a drug that's basically working on 2 completely different clocks in 2 totally distinct phases.
This lays it all out perfectly. In those first 5 minutes, you get the immediate stuff. Venodilation, bronchodilation. This is what reduces that initial crushing pressure on the heart, what doctors call preload. Then, about 30 minutes later, the classic water pill action finally kicks in, and the kidneys start doing their job, getting rid of salt and water, and lowering the body's total fluid volume. It's a 2-stage rocket to recovery.
You really have to think of it like a boxer's 1-2 punch. The first jab is that immediate vascular relaxation. It stuns the problem and buys precious, life-saving time. The second is the knockout cross, that powerful diuretic effect that deals with the underlying issue of too much fluid.
Now, understanding this dual action isn't just a cool piece of trivia. It's absolutely essential for using this drug the right way, safely and effectively.
In an emergency, you can't just guess the dose. Furosemide has this quirky thing called a ceiling effect. Basically, for each person, there's a certain dose where it works best. Giving more than that doesn't help. So the strategy is to titrate fast. You give a dose, you wait an hour to see if the diuretic part has kicked in, and if it hasn't, you double the dose.
You just keep doing that until you find the sweet spot.
And here's another super important thing. When a patient is better and you switch them from IV to pills, it's not a one-to-one swap. The absorption of oral furosemide is all over the place. I mean, it can be as low as 10% or as high as 100%. That's way different from other similar diuretics like torsemide or bumetanide, which are much more predictable. It's why a 40 milligram IV dose might need to become an 80 milligram pill to get the same effect.
Of course, with great power comes great responsibility. A drug this strong is going to have a flip side. Because it's flushing out so much stuff, it can also wash away essential electrolytes like potassium and magnesium, so those have to be watched carefully. The drop in fluid can make people dizzy when they stand up, and in really high doses, it can even cause ringing in the ears or temporary hearing issues. It's a serious drug that demands respect.
Okay, so let's bring it all home and come back to that main aha moment.
Here's the one thing I really want you to take away from this. We all call furosemide a water pill, but in an emergency, that's not its most important job. Its first and most critical role is as a fast-acting vascular drug. That immediate relief comes from its hidden talent for relaxing blood vessels, buying time long before the kidneys even get the memo. It's just a brilliant example of how even the most familiar drugs can be full of surprises. It kind of makes you wonder, doesn't it? What other everyday medications are out there hiding these incredible secret mechanisms, just waiting for us to figure them out?